Hello everyone, today we'll be talking about eyelid terminology for the geneticist. So the eyelid is a fold of skin that covers the globe, otherwise known as the eyeball. You have a upper eyelid as well as a lower eyelid. The caruncle is this red meaty part of the eye right here. It stems from the Latin word carne, which means meat. And for each eye, you have a medial canthus as well as a lateral canthus. Medial canthus as well as a lateral canthus. First be talking about epicanthus or epicanthal folds, which are a fold of skin that passes over the medial canthus of the eye. And we can see here an example of epicanthal folds. The caruncle is hidden by the epicanthal fold you can see here on both sides. This is a person without epicanthal folds, and you can see the caruncle, that red meaty part of the eye right there. Epicanthus is normal in East Asians as well as in babies due to a developing nasal bridge. Epicanthal folds are also seen in Down syndrome. And here's an example of a baby with epicanthal folds causing something known as pseudostrabismus, where the baby seems to be cross-eyed but is actually not. Epicanthal folds can result in something known as telecanthus, which is an increased distance between the medial canthi of the eye. So tele refers to distance, as in telescope, and canthus refers to the corner where the upper and lower eyelids meet, as I've discussed previously. And here we can see a patient who has an increased distance between the canthi of the eye. Again, telecanthus can be caused by epicanthal folds, as seen here. And in this case, the interpupillary distance, the distance between the patient's two pupils, is normal. And this is as opposed to hypertelorism, which we'll discuss next. So hypertelorism refers to an excessive distance between the two orbits. The interpupillary distance, the distance between two pupils, is increased. This is as compared to telecanthus, where it's normal. It can be associated with craniosynostosis syndrome and median facial clefting. Another clue to that would be the bifid nasal tip that we see here in this patient. And hypotelorism is the case where the eyes are too close together, and it's the opposite of hypertelorism. Now, to define hypertelorism, in theory, you should be able to fit one eye's width in between the two eyes. And here we can see it's actually closer to about 1.5 eyes width, suggesting that this patient has hypertelorism. Now, here's a diagram that's focused on some of the distances that I've discussed already and that summarizes them nicely. So this is a pair of normal eyes. We have, in this case, a normal intracanthal distance here, a normal outer canthal distance between the outer canthi, normal interpupillary distance, as well as a normal palpebral fissure length, which is the length of the opening of one of the eyes. Telecanthus, as I've already described, is characterized by an increased intercanthal distance, whereas orbital hypertelorism is described by an increased intercanthal distance as well as outer canthal distance and an increased interpupillary distance. The palpebral fissure length remains normal. Now, palpebral fissures are the openings of the eye, and particularly the distance between the medial and the lateral canthi of one eye. The palpebral fissures can be short or narrow, as seen in Down syndrome, or they can be long or wide, as seen in Graves' disease. Blepharophimosis is characterized by short palpebral fissures, as well as a fixed, not a dynamic, but a fixed reduction in the vertical distance between the upper and lower eyelids. Phimosis refers to a state of being fixed in place. Now, the fissures themselves can be tilted in different directions. So, for example, you can have upslanted palpebral fissures, as seen in Down syndrome or Kabuki syndrome. You can also have downslanted palpebral fissures, as seen in Noonan's or Treacher-Collins. And sometimes the palpebral fissures can be almond-shaped, as seen in Prater-Willi. So next we're going to talk about the eyelid. Ectropion refers to a turning outwards of the lower eyelid. Causes of this can include ichthyosis, facial nerve palsy, as well as normal aging. This is as opposed to entropion, where the lower eyelid turns inward along with the eyelashes. And causes of this include cutis laxa as well as ectodermal dysplasia. Here's an example of entropion where we have the eyelids turning inward as well as the eyelashes turning inwards and irritating the sclera of the eye. Here's another depiction of entropion versus ectropion. We can see that in entropion, the eyelid turns inward, while in ectropion, the eyelid turns outward. Now, I want to contrast these with Epiblepharon, where the eyelid is normally positioned. However, the eyelashes point upwards. This also can be seen typically in East Asian individuals. The eyelashes sometimes, when they assume this vertical position, they can also scratch the cornea, causing some irritation. Now, a way to remember the difference between Epiblepharon and entropion is that with entropion, the entire lower lid enters the eye, i.e. turns inward, compared to Epiblepharon, where the eyelid does not turn in or out. And here's an example, another comparison between Epiblepharon and entropion. Epiblepharon is common, while entropion is rare. Ablepharon is the complete absence of eyelids. This is also quite rare and can result in corneal scarring as the globes are continuously exposed. There's an association between ablepharon and TWIS2 mutations. Lagophthalmos is a condition where the eyelid is unable to completely close while the patient is awake or asleep. And similarly to ablepharon, this can be complicated by corneal scarring and irritation because the globe is exposed. Lagophthalmos can be found in hereditary facial paresis syndromes and frontofacionasal dysplasia. Eyelid clefting is the condition where the lateral part of the eye most typically is separated in an unusual fashion. This can be found in MODA syndrome, which is caused by mutations in FREM1. Ankyloblepharon. Ankylo refers to fused, and blepharon refers to the eyelids. So this is a partial fusion of the eyelids, typically found at birth. Can be found in patients with Chand syndrome as well as AEC syndrome. Ptosis is a condition that is characterized by the drooping or the inability to raise the upper eyelid in particular. And it's presence is suggested by the observation where the upper eyelid margin covers at least part of the pupil. Here we can see the pupil is nicely exposed. Here we only see about half of the pupil. Blepharochaliasis. This is a condition caused by relaxation or bagginess of the upper eyelid, often due to either edema or aging. Here's my references. Thank you for watching. If you found this video useful, please like and consider subscribing to this channel. You can also support more videos like this one by joining my Patreon. Thanks.